Hello, everyone, and thank you for the opportunity to participate and share our recent research project. Um, we'll start with the first phase of the project. It's a study published recently, earlier this year, where we performed a validation assessment of ChatGPT 4.0's performance in the workup of fever among returning travelers. We used our medical records of individuals hospitalized with fever during a time period of 15 years, and their data were retrospectively collected. Our inclusion criteria were adults, those aged 18 or older, traveling abroad, presented to the emergency department with fever during the 30 days following the return. And they also had to have a laboratory or microbiologically confirmed final diagnosis. So these clinical these clinical scenarios at their time of presentation to the ER were prompted to the model, to the GPT model, using a uniform format. You can see it here. We had all the medical history, itinerary details, exposures during their trip, and of course, vital signs, findings in physics, the entire anamnesis, the vital signs, the findings in the physical examination, and the initial laboratory assessment. We used the format, and then we prompted the model with 4 questions, as you can see here. So the first one was, what is the most likely diagnosis? The second one was, what are the 3 most likely diagnoses? The third question was, what are the 3 most important diagnostic tests? And the fourth question asked the model to provide all recommended diagnostic tests appropriate in the case for reaching the final diagnosis. So we aimed to assess the success rates. So our primary outcome was the prediction or the success rate in predicting the final diagnosis when the model was requested to specify the 3 top differential diagnoses. For secondary outcomes, we used similar idea of success rates, but when requested to specify the single most likely diagnosis, and when requested to recommend all necessary diagnostics. We also assessed ChatGPT 4.0 as a predicting tool for malaria itself. So let's move on to the results. So altogether, 114 cases, 14 individuals met our inclusion criteria, and these were all prompted to the GPT as described earlier. You can see that these individuals predominantly traveled to sub-Saharan Africa, but there were also individuals returning from Southeast Asia and from Southern Asia. And the leading diagnoses were malaria, followed by dengue, influenza, leptospirosis, typhoid fever, schistosomiasis, rickettsial infection, and then additional few other infections. So let's have a look at the main results. So we can see here that when our primary outcome was assessed, the success rate in predicting the final diagnosis when the model was requested to specify the 3 top differentials. So altogether, the success rate was quite impressive with 78% altogether, whereas for malaria, it has reached 98% success rate, and for dengue or dengue fever, we can see that the success rate was about 95%. When we assess the secondary outcome, that was when the model was requested to specify the single most likely diagnosis, you can see that although these were somewhat lesser impressive than the primary outcome, the success rate was still very high, considering that it was a one-hit trial. So the model predicted 68% of all cases, and for malaria, it reached 90%. For dengue cases, it reached 84%. And when the model was requested to recommend all necessary diagnostic tests appropriate for the specific case, you can see that the success rates were also quite high, with about 83% for all cases and 100% for the malaria cases. We also used two tables to assess the model, or the ChatGPT 4o, as a diagnostic test for malaria, or for recommending malaria testing. It is important to explain, or to note, that here we used our secondary outcome. So it means that we considered a malaria recommendation to be appropriate only in cases where this was the most likely diagnosis according to the model. So as you can see here, it has a quite well AUC of 92%, and the kappa was 0.84. And now, even if we look at these so-called model misses, so you can see here that among the 5 patients for whom the model did not specify malaria as the most likely diagnosis, it did suggest it as the second most likely diagnosis. And in the remaining case, although not suggesting malaria among the three most likely diagnoses, it still requested malaria diagnostics when requested to list all the desired or all the necessary diagnostics. So we can say that altogether, if taken as a tool, it could have had 100% sensitivity. And of course, for malaria, a life-threatening modifiable disease, it's quite important. And this was a quite impressive result. As for the 4 cases mistakenly classified as malaria cases, so all arrived from malaria endemic areas, so one can say that these were quite reasonable. However, the model also had several faults, and the failure rates were non-negligible at all. We had altogether 18%, 20 cases out of the entire cohort. 3 of these were occurring in individuals that required immediate antibiotic therapy, such as typhoid fever and disseminated gonococcal infection. And 16 or 80% of these cases were globally endemic infections, such as influenza or infectious mononucleosis, where we have seen several cases, respiratory syncytial virus infection, disseminated gonococcal disease, as I said, and we also had one autochthonous acute Q fever. These cases were missed, or were even totally missed by the model, who did not consider these endemic infections at all. So we concluded that ChatGPT 4o demonstrated high diagnostic accuracy, and it is even more impressive when we consider that we prompted the model with the scenario as it was at time of presentation to the emergency department, with only initial testing and before even the primary serological or culture results. So the success rates were quite high, with 78% for specifying the top 3 differential diagnoses and 68% for specifying the most likely diagnosis. And regarding malaria, which is, as said, a life-threatening and modifiable condition, ChatGPT would not have missed even a single case, yet it had a non-negligible failure rate, particularly when dealing with so-called cosmopolitan infections or cosmopolitan diseases endemic throughout the globe. Uh, Nowadays, I have the honor to collaborate with Dr. Sarah McGuinness from the Monash University, where we are these days initiating our second phase of the study, where we plan to compare the performance of the ChatGPT to physicians in predicting the final diagnosis. We will use a larger pool of real-life cases from 10 different healthcare centers around the globe. We will use both single prompting to signify point of care usage and multiple simulation to assess the consistency, and we will distribute these questionnaires to physicians in from different disciplines and from various regions to allow comparison between men or physicians and the model. So this was quite brief. So if you have any further questions, feel free to contact me, and I thank you very much for your attention.